animatedanatomy.com. So, because some of my recent videos about vagina anatomy and female sex organs anatomy have been removed by YouTube because it says they had an adult content, and one of them has been age restricted, I decided to make one more video about vagina anatomy and to show the vagina again. So, here we see the female body, and the female body in this case, we don't need the muscular system, or actually we do. Just to show you one muscle here, it's a small muscle, and it's this muscle right here. It's called the bulbospongiosus muscle. If you're learning about the physiology of the female sex organs, then you might need to know the bulbospongiosus muscle. Now, if we remove the muscular system, we should remove the digestive system. Well, we might just as well remove the skeletal system. Here we see some organs. And let's start by explaining you the reproductive organs. In reproductive organs, we include the breasts as well, but in this case, we're talking about here the lower organs. And let's start by explaining this here. This is the vulva. And this right here is the clitoris. This is what you see from the outside. It's the external female genital organ. Then you have here a vaginal opening, and that's where the penis enters during the intercourse. And this here is the vagina. This here is the uterus, and those are the fallopian tubes through which egg cells are traveling through. The egg cells are located here in the ovaries, left and the right. The egg cells come from the ovaries. They travel through the fallopian tubes. They get fertilized somewhere on their way. Then they nest in the uterus, and if they're fertilized, the baby will grow. And eventually, when baby is done with growing, it has to pass through vagina and come here through the vaginal opening. This can be very painful. That's why doctors can sometimes cut here in order to allow the easier birth. And this is painful as well, but less painful than having a very tight vagina and having a very big child. Yeah. Well, you might have noticed there is also small here, very small hole right here. And that has nothing to do with reproductive organs. That's basically a urethra. It's coming from the bladder. Now, if we zoom out, you will see other organs here as well. And those are the urinary organs. Those are not the reproductive organs. This here is the right kidney. Kidney is basically a filter. And everything that gets filtered out of your blood goes through the kidney, then enters the urethra, and then goes all the way down to the bladder. From the bladder, it exits the body through the urethra here. So here we see the vulva, and well, let's start from up there. Here we have the clitoral hood, and here is the clitoris. We were able to see that on our 3D model as well. Here is the labia minor and the labia major. And here is the urethral opening. This is where the urine comes out. And here is the vaginal opening. That's where the baby comes out, or the penis goes in. This right here is the perineum, and it is the place between the vaginal opening and the anus. Now, this place is important for the people who ride the bike or ride horses. They can exert pressure on this area and therefore compressing the perineal nerve, causing the dysfunctions in their sexual life as well in the anus. And the anal sphincter can be damaged. The function of the anal sphincter can be damaged. So here we see everything from the sagittal, in the sagittal section. Here is the labia minor and the labia major. that I explained. Here is the urethral opening and the urethra, and then here is the bladder where the urine is. Then here is the vaginal opening, and then here comes the vagina. And of course, here you have the cervix, and then is the uterus. You should notice that here the vagina goes behind the bladder, and the uterus is kind of going over the bladder. And the cervix is important place because there are numerous cancers and sexually transmitted diseases associated with this place. That's very important to know. So here you can see that in 3D as I've just illustrated from the sagittal slice. The cervix is here, this is vagina and the uterus. Now I will explain uterus a little bit more into detail, and then I will explain the fallopian tubes and the ovaries. So here we see the layers and the arteries of the wall of the womb. And the inner layer is called the endometrium. The middle layer here is the myometrium. And there is also one more part, and that is the loose connective tissue around the womb, and that is called the perimetrium. So what I just explained is incredibly important for the implantation of the egg cell that comes from the ovaries here. Remember, the eggs from ovaries come here, they go through here, they get fertilized, they reach the uterus, and they get implanted. And the entire implantation process and steering of the process with the hormones and growth of certain parts of the wall, it's a very important thing to know, and this is a very important part of the lesson. One of my fans from San Diego had a major surgery in this area, and he made a request for me to make the video so he understands the anatomy better. And I'm also remaking this video because my old video on male reproductive system got restricted by YouTube, and they marked it as a sexual content, which is ridiculous. So basically those are the two reasons why I'm remaking this video. So let's start by explaining the two major sex organs. That includes the penis here, and we have the testicles. And testicles is basically where the sperm cells are produced, which later travel through the penis and they enter the vagina, and that's how the egg cell in the female body gets fertilized. I talked about that in my other video on female reproductive system, and I explained how it develops into an embryo and how the child is born. So let's start by explaining the penis. As you can see here, there are two different structures here. This one here is the glans penis, and this is the corpus cavernosum. If we add skin on it, we would normally call this part of the penis shaft. So the human skin goes like this, and it goes over the penis here, over the shaft, and then a small portion of this skin goes over the glans. So this skin can be, it used to be a very big problem in history because of the infections and everything that could happen here. So people developed a surgical procedure called circumcision in order to remove this part of the skin, right? So of course not to remove the glands of the penis, but just to remove this portion of the skin. This circumcision, the healthcare provider will most likely numb the penis by injecting the anesthetics here in the bottom of the penis, and it heals quite quickly, right? It's not so scary as it sounds. Now, some people do that circumcision not because of medical reasons. Most recently they just do it for religious reasons. And here we have the meatus. It's the place through which urine stream is coming out. It's something that could be compared with urethral opening in vagina. Of course, it's basically the same function. However, here we also have additional function, and that's also the semen flow during the sex intercourse, during the sexual intercourse between the female and man. Now, as you can see, the testicles are here, and that's where the sperm cells are produced. and then they go through vas deferens, and they through the prostate, and then they enter here in the corpus spongiosum of the penis, right? It's the body between or below these cavernosum bodies of the penis. It enters here, but it doesn't really enter that. It enters, when I remove it, you will see it. It enters actually the urethra of the of a human, and that's how it exits the human body here through the urethra. That's why in male body, urethra has one additional function. So now we're looking at the penis from the superior point of view, and if you can just remember, like a few seconds ago, I mentioned some structures, and here we have for example, the corpus cavernosum of the penis on the left side, and on the right side as well, we have the corpus cavernosum. Down underneath, we would be able to find the corpus spongiosum of the penis. Now, these bodies are important for the erection as well. They are like sponge-like tissue. They are filled with blood through the cavernosal arteries that are going through them, right? We cannot see them from this point of view. And there are also connections, for example, here through the dorsal arteries of the penis, these two arteries here. Now you're probably wondering, okay, it comes in there, what happens? Well, you get an erection, and the blood comes to your head, and you still don't get an erection. So what's the deal? How does this mechanism work? Basically, this artery here is the main artery that drains the blood away from the penis. And there are other few arteries, but let's say this is the main artery, and you can see these little arteries here also that connect through to that artery. And once you have the increase of the pressure in the cavernosal bodies here, what happens is that this vein gets pressed on the fascia here in tunica albuginea, right? It gets so pressed in that way that it cannot drain blood anymore, right? It obviously does drain, but not as much as it should. So you have a pressure difference here, and of course that causes the penis to inflate. And because it's kind of like a sponge-like tissue, it grows in size and it grows in strength, and that's how you get the erection. Now that you understand the erection mechanism, it is also important to talk a little bit about the length of the penis. The length of the penis can be increased by cutting this ligament here, fundiform ligament. It's a suspensory ligament for the penis, and that gives you a little bit more extra length. Or I wouldn't say it gives you length; it just makes your penis more forward, and it kind of like makes it look bigger, right? So this can have serious consequences. This can have serious consequences because here you can see we have the dorsal nerves coming out, and uh, there are multiple studies that have confirmed that people who had this surgery actually ended up with some loss of sensitivity, which is quite irritating, I would say. Now we're looking at the sagittal section of the body, and you can see here the structures I mentioned earlier. Uh, Quite important structures, but we were not able to see them in our previous image. For example, the urethra. You can see the urethra here. It's here is the prostate, and the urethra from here all the way to the external urethral opening. Now, urethra is draining the urine from the bladder. Okay. Now, as I mentioned, urethra had one extra function, and that is the drainage of the semen. And here you can see it clearly how testicles are the ones that produce the sperm cells. Then the sperm cells go through here to the vas deferens, then through ejaculatory duct here, and then they enter urethra again, and they can be ejaculated further. Now, since we already reached this topic, I will immediately start explaining the scrotum, and I will start explaining the testicles, right? Now, remember in penis we had a tunica albuginea, and that was important for the erection process in order to uh, compress the dorsal vein of the penis. Now, here, this albuginea tunica is expanding, and it also covers the testicles. This is that tunica here. And here inside it goes in as a septum, and it separates basically seminal vesicle lobules here. Now the seminal vesicle lobules from here, they continue as the straight vesicles. Now the seminal vesicle lobules, they here you have from them coming out the straight tubuli, and the straight tubuli at this part are called the uretratestis. Now the product of testicles continues to flow through the efferent ductuli here and here, and it enters the body of epididymis. Now the epididymis is already another organ here, and it has certain parts. That's here we have the tail of the epididymis. Here we have the head of the epididymis, and here you can see the body of the epididymis. Now if we look at our 3D model, we can zoom in here, and here is this organ epididymis, and basically the epididymis is the organ that connects the testicles with the vas deferens. Vas deferens I mentioned earlier. Now this looks quite messy. Let me remove some of these drawings I made, and let's use a different color. As I said, here we had the head of the epididymis, then the body of the epididymis, and here was the tail of the epididymis. And it goes into this order not because somebody just thought of it, but because here at the tail, the epididymis is turning into vas deferens, and that's how vas deferens is going further. Now we must look closer to the path of vas deferens because there are a few details important to mention. So here we have the vas deferens leaving the epididymis, and as you can see, it goes all the way here, and then it turns into ampulla of ductus deferens. So this part of vas deferens, it's called the ampulla of ductus deferens. That's at the very end, and then further the vas deferens is here going through. It's called the ejaculatory duct, and it connects to the urethra. Basically, that's how the ejaculation path goes. However, one detail that I didn't mention earlier was that the seminal vesicle here is producing the fluid that is mixed with the semen coming from the testicles, and as such, it's ejaculated outside. So exactly this organ here was the organ that one of my subscribers had removed. So hello to San Diego, and if you're watching, I hope you're recovering. I hope everything is okay. Now, I don't know exactly the diagnosis that he had, but I can assume already that here, this organ, it very often develops a malignant tumor. And a malignant tumor in this organ, we prefer to remove the entire organ as soon as possible, because once this tumor reaches out and once it passes the capsule of the organ, it starts growing much faster. It can metastase really quickly. But if we do it on time, the prognosis is good. So we prefer to remove this organ, and then we're dealing with multiple other issues. You see the nerves here that innervate this area are either damaged or partially removed during the surgery, and this can cause issues in sexual function. It most common issue is inability to have an erection, bladder issues, inability to stop the urine flow. Now this type of surgery was old. Now we have new surgeries, the sparing nerve surgeries that were developed, but and it is a incredible improvement, but I would still say it's not 100% improvement, right? Now there are other issues with this organ as well. For example, almost in every human, we have the hyperplasia of the prostate gland as they age, and this can cause pain when sitting, or it can cause the inability to urinate, for example, because the urine flow is blocked. So here you have the bladder and the urine cannot go out. So what we can do, for example, in these older men that cannot urinate as they used to when they were young, we can give them the medication to relax the sphincter here. and that makes the urination process easier. So here we can see it in 3D. We had the testicles, epididymis, vas deferens. Here is the seminal vesicle that I said, and both what comes from the vas deferens through the ejaculatory tract inside of the prostate gland, and what comes from the seminal vesicle, it gets mixed in the prostate gland, and then through the urethra here, through the urethra and the spongiosum body, it exits the penis and it gets ejaculated. Now, one thing I want to say, I think it's important because people confuse it quite often, right? Here we have the urinary system, and this is the kidney, the right and the left kidney, and this part is called the urethra, right? It is not called the urethra, and people confuse this often. So urethra is before the bladder. Here is the bladder, and the urethra comes after the bladder. So, but don't confuse it. This belongs to the urinary tract. And now I hope that YouTube will not restrict this video, because this video is really not sexual content. I hope they will not restrict this video, because this video is really just a educational video. We don't even show the real human parts. We show the imitation of it, the 3D models. And remember, we had the testicles, we had the seminal vesicle, vas deferens, spongiosum body, cavernosum body, glans penis, and we had here, of course, I said the seminal vesicle as well. Oh yeah, inside here we had the urethra, and not the urethra, but the urethra here, right? Prostate gland was here. Hello everyone, I developed Animated Anatomy that you can purchase on animatedanatomy.com. I put them links down there in the description, or you can click on a link here in a video. If you're not going to purchase my software, then at least make sure you leave a positive comment, subscribe, or like my video.